Okay, last part for our chapter 9. So this really just only section 9.3, which is the selected diathroses. So looking at specific joints, so looking at our jaw, shoulder, elbow, hip, knee, and ankle joints. So I'm going to skip to the last slide of the PowerPoint so I can get the quick details of all that you would need to know for this section, and then I'll go back and explain them. So, let's come over here. You know what? Just do this. Oh, wait. Okay, so at the end of chapter 9's PowerPoint, I have all of the basic information for that last question on the study guide. So I'm going to go through those and then explain what they are, so you just don't have a bunch of vocabulary words and don't know what I'm referring to. Okay, so first column has your articulation or your joint. The second column focus on the special features of that joint. So the first one is our jaw joint, our temporal mandibular joint, so between the temporal bone and the mandible. And what's unique about that joint is that it's separated into two chambers by an articular disc. The next one is the shoulder joint. It has two different names. So between the glenoid cavity and the humerus, or between the humerus and the scapula. So this is one of our most freely mobile joints because you don't have a bunch of weight pressure on that joint. You just are attaching the arm to the body. So very freely movable. Shallow glenoid cavity, and that is contributing to that mobility because you don't have anything blocking. So you don't have a deep cup in that ball and socket joint in order to restrict movement. Supported by your biceps brachii tendon as well as your rotator cuff tendon. So again, just helping to attach your arm to your body. Next one is elbow. So two joints in one joint capsule. So we have the humeroradial joint and the humeroulnar joint. So between the humerus and radius and humerus and ulna. So this is a hinge joint. And so it's going to have that one monoaxial type of movement. It also has a proximal or close by radial ulnar joint, which is a pivot joint. So between the radius and the ulna. Okay, next table has the last few joints, and then I'll go through the more details and pictures and whatnot. So our hip joint, which is also called the coxal joint. So remembering that we have our os coxa hip bone there. So it's the head of the femur into the acetabulum of your os coxa. So special things of it is a ball and socket joint. So the ball being the head of the femur and the socket or cup being the acetabulum of your os coxa. Because this joint has to bear weight, so it has to hold weight of your body, your upper body more specifically, it has deeper sockets, so that acetabulum is going to restrict movement, so it's not going to move as much as your shoulder, but it does make it more stable than the shoulder. Next joint, knee tibiofemoral joint, so between your tibia and your femur. So this is a hinge joint. It also includes your gliding joint, a plane joint between the patella, so your kneecap bone, and your femur. A unique feature of this is that it has those meniscus fibrocartilage plates in there, so the lateral one on the outside and the medial one on the inside. So it absorbs shock, so as you jump on top of something, it also prevents side-to-side motion. Last one is the ankle joint, so our talocrural joint. So between the talus, the top part of our tarsal bones in our ankle, and then our tibia and fibula. So on our tibia and fibula, so remembering stuff from the bone exam, our fibula has the lateral malleolus, your tibia has your medial malleolus, and both of those joints, overhangs of those bones, they actually prevent side-to-side rocking, so helping to stabilize your ankle. Okay, so now I'm just going to go through the pictures of what I just talked about so that you can see how they're functioning and how those vocabulary words I just threw at you, how that works. Okay, so first one, your jaw joint. So temporomandibular joint. So here is that articular disc that is separating that joint cavity into two different chambers. So again, has a lot of usage dealing with talking, breathing, eating. So you need that extra structural support. Oh, so some of the joints also have extra slides talking about other things that help to put the joints together, but what I just showed you with the charts is what you need for the exam. So other ligaments that help support it. Okay, so next one is the shoulder joint. So the shoulder joint, again, your glenohumeral or humeroscapular joint. So most freely mobile, shallow glen cavity, and a loose shoulder joint capsule that helps with the movement. And again, your rotator cuffs as well as your biceps brachii tendon help support it. You don't have to know the names of these rotator cuff tendons for my class, but you do need to know them if you're going to, at least I know for your nursing school, you do need to know the rotator cuff tendons. Easy way to remember that is SITS, so based on SITS, the letters that make up the front of the word, starting letter. Okay. So, I think I want to show it from, they're also showing all the different ligaments and bursa in there because you have a lot of movement, muscle there. I like this picture really good. The subdeltoid bursa, so underneath the deltoid muscle, there's your sub portion. So prevent that rubbing there at that joint. So we have our joint cavity here. So in that glenoid cavity from your scapula and then the head of your humerus, which is the ball of the ball and socket, that's where that's fitting to create that joint. Okay, next one, elbow. So again, our two articulations in one joint capsule. Let's see which one. Oh, there it is. So here we have our humerus here, and then you have one joint and two joints created between your first joint between your ulna and your humerus, the other joint between your radius and your humerus. So again, bunch of more ligaments helping to, and tendons helping to keep and support it structurally since it is just hanging off your body. Okay, more pieces, more showing. There we go. Okay, next one, hip joint. So our hip joint is where the head of the femur fits into the acetabulum of the hip. So your acetabulum, way more deeper than that tiny little speck of a curve in your scapula to create the glenoid cavity. So your acetabulum is a much deeper, more solid structure for that socket. So our head of our femur fits well nicely into the acetabulum, so it makes it more stable, allows it to bear more weight, but that also means that it's less flexible. Okay, so again, a bunch of more ligaments and tendons helping to hold it together. So these are kind of the cool ones. So you have tendons that connect each part of your os coxa, so your pubis, ilium, and ischium, attaching to the femur. And when you stand up, they actually twist around the head of the femur to shove that into the socket, and that actually helps to make that even more stable. A round ligament connecting that fovea capitis in the head of the femur and that attaches into your acetabulum. So again, just making sure that attachment stays nice and sturdy. Okay, next one, knee joint. Button. Okay, so tibiofemoral, so between the tibia and the femur. So hinge joint, so just our one back and forth type level of movement. You also have the patellofemoral joint, so between the patella and the femur, so right here. So just like a plane joint gliding right past each other, just that one flat plane. So that's also in that area. Okay, so this actually has I think I zoomed in on another slide. Hold on. I'll come back to that one though. Okay. Nope, this is the biggest one I see. Okay, cool. So with our meniscus, so our lateral one on this side and our medial one, so we're on the left side of this. If you're looking downward, left side. Okay, so those are the fibrocartilages that will grow into that joint, and that just helps to stabilize it, so it makes an even deeper cut. So just cup. So just like your acetabulum is a deeper cut for stabilization, those fibrocartilages make a deeper cup for that joint. Also prevents side-to-side rocking, absorbs shock, so just holds everything in place so you can walk and do everything you do on your knee. Okay, so this I'm just going to go back over. So remember, going back to our bone exam with our patella bone being a sesamoid bone, so a sesamoid bone being inside of a tendon. So here we have the quadriceps tendon, so that big thick muscle at the front of your upper leg. So that tendon continues over the top of the knee, so one of the tendons that just helps with keeping that knee joint together. That patella bone is actually inside that tendon. So we got, again, more ligaments and everything, holding everything together. And for my athletes, so ligaments on the side, connecting tibia to femur, as well as connecting the fibula to the femur. There we go. Okay, so in the middle of the knee, you have two tendons going from front to back or back to front. So your ACL and your PCL. So these are the ones where if you tear that sucker, you're out for the rest of the season. So that kind of is a big major portion of the stabilization of the knee. And so that's why you definitely want to protect your knees, not just athletes, but also just in general, because yeah, I've seen people who've had knee surgeries and it's not fun. Yeah, you get into old personville real quick, having to walk around with a cane just because your knee is not stable enough as it's healing, because you had to have surgery. Okay, so with our knee joint, we have at least 13 bursa that are helping to cushion it. We say at least 13 because we're still finding stuff. But again, a lot of movement in that area with our tendons and muscle and bone and skin moving around. So you do want to have a lot of cushion in that area. Okay, last one, ankle one. So up top we have our two lower leg bones. We have our tibia on the inside, our bigger one, our fibula, our little tiny skinny one on the outside. So our malleoli that overhang the talus joint, those are going to prevent side-to-side rocking for the ankle. So again, just ankle stabilization. So you still have two joints in that area in one joint capsule, but we want to focus on these malleoli. They're helping to keep stuff stable. Okay, with our other joints, same thing. Bunch of tendons and ligaments helping to support it. So muscle exam, actually a little bit of bone exam as well. So our bone exam, the calcaneus is on there, and the tendon that connects from our calcaneal bone up towards our calf muscle is the Achilles tendon, or also called our calcaneal tendon. So the calcaneal tendon being on your muscle exam. Okay, so this is just a Another view, again, more ligaments and tendons helping to keep everything steadied and together. And these are those tables I showed you at the beginning. Okay, so again, fill out that study guide. Ask me questions if you need to. Thanks for listening.